Hey guys, so I thought I'd share with you what I do every single day to never get a cavity. So I'm not trying to brag or anything like that, but I do know a lot of people are making some simple mistakes, or they just don't understand simple things that they can start doing so that they can never get cavities. So how does a cavity form in the first place? So a cavity forms from the enamel into the dentin. So from the outside of the tooth to the inside. Now once this cavity gets into your dentin, now you have a hole in your tooth. And this is when you have a cavity. Now you don't just magically wake up one day and end up with a hole in your tooth. This cavity takes time to progress to get into your dentin. Now this is a process called demineralization. And basically what's happening is your tooth is just getting weaker and weaker, and eventually that leads to a hole. Now if this demineralization that's going on is still just in your enamel, then it's not considered a cavity. And you can actually remineralize it and strengthen it back to normal. Now your teeth are constantly undergoing this demineralization and this remineralization. But if this demineralization starts occurring more than this remineralization, that's when you can get a cavity. And this is why it's super important to go to the dentist every 6 months to get your checkup done, to get your cleaning done, and also to get all your x-rays every year so that they can check and see if you have any of these small lesions that are forming. For example, a dentist can look at your x-ray and see that you might have a cavity that's starting off, but it's still just in your enamel. So you don't have to get a filling or anything like that, but you can start taking the measures now to prevent that cavity from getting worse. But I want to talk about my routine at home and what you guys can start doing to never get cavities. So first thing, pretty simple. I wake up in the morning and I brush my teeth. I personally use an electric Oral-B toothbrush. Now you don't have to use the same toothbrush I use, and you don't even have to use an electric toothbrush. It is better, but you can still get good results with a manual toothbrush. But when you're brushing, you really want to focus on getting every single surface of all of your teeth. So the way that I do this is I separate my mouth into quadrants, and I focus on just brushing one quadrant at a time. So those quadrants would be your top right, top left, bottom right, and bottom left. And what I do is I start off by just focusing on cleaning the cheek side of all my teeth, one tooth at a time. And then once I get to the end of that quadrant, then I go on to cleaning the biting surface of all my teeth in that quadrant. Again, I go one tooth at a time, getting the biting surface of every single tooth. And then last but not least, I get the tongue surface of all my teeth, one tooth at a time again. Now, if you're using an electric toothbrush, it's really important to not move that toothbrush around. That electric toothbrush is doing all the work. So all you need to do is hold it lightly against each of your teeth individually and hold it there for a few seconds and let that toothbrush clean your tooth. If you use a manual toothbrush, you want to make sure you're using some sort of circular motions on every single tooth. Now when you're brushing, you want to really make sure you're focusing by looking into the mirror. Because when you look into a mirror for 2 minutes and really focus on cleaning every single surface of all your teeth, you might see that you're probably missing a lot of areas. And also you want to really focus on angling your toothbrush in the right spots. Because your teeth aren't all just flat. They have these different angles to them. For example, as your teeth get closer to your gum line, then they kind of curve in a little bit. So as you're getting closer to the gum line with your toothbrush, you want to make sure you also angle your toothbrush. So try to angle it at about a 45-degree angle as you get closer to your gum line to really make sure you're getting all of your tooth surface. Now some people also floss in the morning. I personally floss at nighttime. Some people floss both morning and night. That's even better. But every time I brush my teeth, I also scrape my tongue. So you can get a tongue scraper pretty much anywhere on Amazon or any convenience store, and all you have to do is basically scrape your tongue a few times and then rinse it off. What that's doing is it's really eliminating a lot of the bacteria that's sitting on your tongue. And that's also really going to help prevent bad breath, because a lot of those bad breath bacteria rest on your tongue. Now, a lot of people wonder which type of toothpaste should they use, and should they be using a fluoride or a fluoride-free toothpaste? Now, really, there's two types of people. There's people that love fluoride, and there's people that hate fluoride. Now, I'm not here to tell you who's right and who's wrong. I'm not here to pick a side for you. Personally, I use a fluoride toothpaste, and I've been using one ever since I was a kid, but that doesn't mean that you have to. If you don't want to use a fluoride toothpaste, then don't. There's other options out there. But I do want to explain the difference between the fluoride toothpaste versus a non-fluoride toothpaste like a hydroxyapatite toothpaste. So our teeth are made up of these crystals called hydroxyapatite. Now these crystals are held together by these bonds. Now when fluoride gets in contact with our teeth, it sort of remineralizes these crystals. And it takes that hydroxyl ion that's in that hydroxyapatite crystal and replaces it with a fluorine ion. So now, instead of it being called hydroxyapatite, it's called fluorapatite. Now the benefit here is these crystals and these bonds can be held tighter together. So your teeth basically get more compact. Now, the reason that this is good is that it strengthens your teeth, and specifically, it makes it more resistant to acids. So normally, your hydroxyapatite crystal will break down or demineralize at a pH of 5.5. But when it turns into fluorapatite, now it won't break down until a pH of 4.5. So it takes a lot more acid to break down a fluorapatite crystal versus a hydroxyapatite crystal. But instead, if you want to use a fluoride-free toothpaste, the one I'd recommend is something that has hydroxyapatite in it. So now you're still getting that remineralizing, but it's keeping that tooth structure, that natural hydroxyapatite crystal. But now that also means that the pH that you need to dissolve that tooth is still 5.5. So in other words, if you use a hydroxyapatite toothpaste, then your tooth is going to be slightly easier to break down. Now let's say that you do get a cavity, and this cavity gets into your dentin. Now this pH only has to be about 6.2 to 6.4 to start demineralizing your dentin. So that means that this cavity can spread way quicker. And what happens is it basically makes a beeline straight to your nerve. So now you're probably going to have a lot of pain, a possible infection. You're probably going to need a root canal, or you're possibly going to need that tooth extracted. Now, technically, after you brush your teeth, you're not supposed to rinse with water after, because the theory is you want to keep that toothpaste against your teeth to keep that remineralizing going all day long. Now, me personally, I do rinse my mouth with water after. It's just a habit that I've had growing up. Now, throughout the day, I really only drink water. And again, this is a personal thing for me. I just never really got into any soda or coffee or tea or anything like that. I mean, occasionally I'll have a green tea or something like that, but really the only thing I drink is water. Now, I really think this played a big part into why I never got a cavity, because it's not just the sugar you have to worry about with all these other sodas and drinks out there. Because even if you have a diet soda or something like that, it can still cause harm to your mouth. And the reason is that a lot of these drinks are still acidic. So we know now that acid is bad for our teeth, but if we drink something that's already acidic, then it's going to make us much more likely to get cavities, because our pH that's in our mouth is going to naturally be a little bit lower, meaning we're going to be way more prone to getting cavities. So here's what happens. You have this bacteria in your mouth, and the bacteria that causes cavities is Streptococcus mutans. So anytime you eat some sort of sweet or something like that, the strep mutans will eat that sugar, and in turn, it'll produce an acid byproduct. And this acid will sit on your teeth and slowly dissolve your tooth, and eventually it can form a cavity. Now let's say that instead of your pH normally being at 7, now your pH is at 6 because you've been drinking all these acidic drinks. Now it really doesn't take that long for that strep mutans acid to cause a cavity. So I really want you to think about what you're drinking throughout the day. Pretty much anything other than water is acidic. Even coffee and tea are acidic. So if you're sipping on these drinks throughout the day, then that's going to be really bad for your mouth. What you really got to understand is the frequency matters of how often you're having these drinks. It would be better to have that whole drink all in one sitting, or in like 10 to 20 or 30 minutes, instead of constantly sipping on it throughout the day. Because even if you take a sip throughout the day, that small amount of liquid is still changing the pH in your mouth and potentially still feeding the bacteria in your mouth that cause cavities. Now this kind of goes into the next thing that I do, which is I do not snack throughout the day. Now I'm also not really into eating sweets or anything like that, but it's really not just sweets that cause cavities. Pretty much any carbohydrate can cause cavities, because you have that strep mutans bacteria in your mouth, and it eats any carbohydrate. And any carbohydrate it eats, it will release those acids and cause a cavity. So that means things like chips, crackers, bread, other starchy foods can all cause cavities too. So kind of like the last point I made, it really depends on the frequency that you're eating these. If you're just having one slice of bread at one point of the day, then it's not a big deal. But if you're snacking and biting into crackers and bread throughout the day, then you're going to be constantly feeding those bacteria in your mouth, and you're going to constantly be having those bacteria release more acids in your mouth, and you're going to be way more likely to get cavities. Remember, think more about the frequency and not as much about the volume. And also another thing you can do is to eat these foods with a meal and not just have it alone in the middle of the day. So for example, if you're going to eat some chips and you're going to drink some soda, it's better to do that with your lunch or with your dinner and not just do it in the middle of the day. Because anytime you're eating a meal, you're going to produce more saliva in your mouth. Now your saliva is basically a natural bodyguard that protects your teeth because it has a lot of minerals in it, and it also can wash away a lot of plaque and leftover food and debris in your mouth. So if you already have more saliva when you're eating a meal, it's better to have those starchy or acidic or other foods that can cause cavities. And you can also rinse with water after. So let's say you just have a sip of coffee, try rinsing with water after, because then it can kind of neutralize some of that pH in your mouth. Now, something else to consider is to get checked for GERD or some sort of acid reflux. Because let's say that you never eat any sort of sweets or drink any sort of acidic beverages, but you're still struggling. Well, it's still possible that you have an acidic mouth, and possibly from GERD. And a common sign that we see with GERD is that your teeth will start to erode. So they'll kind of wear away and they'll start to turn yellow because the top layer of the teeth starts to kind of erode. And a common sign with GERD is erosion on our teeth. So basically, the top portion of our teeth starts to wear away. And specifically, we see this more on the tongue surface of our top teeth. But if you have GERD, then again, it's gonna lower the pH of your whole mouth and make it way easier for you to get cavities. Now, something else I like to do is chew on a xylitol gum between meals. Now, first of all, if you're chewing gum, you wanna make sure it's sugar-free. But xylitol gum will do a couple specific things. So first of all, any gum will produce more saliva in your mouth, and that'll help kind of clear away things and basically protect your teeth. But also, xylitol specifically has been shown to prevent cavities. Now, no other artificial sweetener or sugar alcohol has ever done this. All the other ones basically either don't cause cavities, or they can cause them, but very rarely and way less than an added sugar would. But xylitol is the only one that actually helps prevent cavities. And I also don't drink alcohol. And again, this is for personal reasons and also for health reasons. But alcohol is terrible for your mouth because it is a diuretic, meaning it makes you pee more and it makes you more dehydrated, and this can lead to a dry mouth. And we've seen that when you don't have enough saliva in your mouth, then you're not gonna have that natural bodyguard protecting your teeth, and you're gonna be way more likely to get cavities. Now, this is also why I don't like mouthwashes that have alcohol. I actually never recommend mouthwash with alcohol to anybody. And honestly, I think it does more harm than good because you're gonna be drying away all those tissues. But a mouthwash I do like is called Carry-Free. Now, I'm not endorsed by them or anything, but I do personally use it. The cool thing about Carry-Free mouthwash is that it has pH balancing, meaning it actually helps raise the pH of your mouth, so it makes your mouth less acidic and less likely to get cavities. Now, this mouthwash does also have fluoride in it, so again, if you're anti-fluoride, then don't use it. Now, you also want to watch out for some of the medications that you're using, because a lot of medications out there can cause xerostomia, or in other words, a dry mouth, which will lead to more cavities. This happens a lot of times in older patients, where they haven't had a cavity in a long time, but then they've been on these medications and their mouth has just been so dry and they don't have that saliva protecting their teeth. And then a lot of their old dental work starts to fail, or they start to get these new cavities. So if you have this dry mouth, try talking to your doctor and seeing if there's any way to adjust your medications or to lower your dosage a little bit. And if there's no way of getting around it, try focusing on drinking a lot of water throughout the day and also rinsing a lot of water to kind of wash away any debris in your mouth. Now, the next thing that I focus on is my breathing. Yes, the way that you breathe can influence whether or not you get cavities. So throughout the day, I really focus on only breathing through my nose. And part of the reason is mouth breathing really dries out a lot of the saliva in your mouth. Actually, mouth breathing causes 42% more water loss compared to nose breathing. And this is especially true on the exhale. So try breathing out on some glass. First, try doing it from your mouth like this, and then try doing it from your nose like this. You'll notice that when you breathe out from your mouth, you're gonna fog that glass up a lot more, versus when you breathe out from your nose, you probably won't fog it up at all. And the reason is a lot of that moisture is just escaping when you exhale from your mouth, versus when you exhale from your nose, a lot of that moisture is being retained. And I also focus on nose breathing while I'm sleeping as well. So the way I do this is I simply tape my mouth shut. So the tape that I use called a 3M micropore paper tape, which is basically a medical grade tape that's safe for your skin. You can also really use any mouth tape out there. There's a bunch of different ones on Amazon. But if you're waking up every morning with a really dry mouth and you're really thirsty and you're drooling all over your pillow, those are all signs that you are a mouth breather. So I made some other videos on mouth breathing specifically and how you can start breathing through your nose more, especially if you already have a blocked nose. So I'm putting a link in the description below so you can check those out. Now, the last thing I do before bed, again, is I brush my teeth again. Same way I described before. but I also floss my teeth. Now, the correct way to floss is something called C-shaped flossing. The way to do this is to basically curve that floss against your tooth into kind of a C shape and to go up and down and also underneath your gums. And then you go against the tooth next to it and again curve it to a C shape and go up and down underneath your gums. This is just another way to really angle that floss correctly so you can get all of your different tooth surfaces. Now you can also use a water pick. I personally do not use a water pick, but a lot of my patients do, and I've seen some really great results when they use it. So that's another thing you can try, especially if you hate flossing. So hope you guys like that. That's basically my whole routine, plus some other tips to help prevent you from getting cavities. If you have some other tips that I haven't mentioned, make sure you let me know in the description below. There is a lot of confusion out there right now about what we are supposed to eat. We're at a point where we don't even know if vegetables are healthy anymore. Now, one hot topic among a lot of different diets is red meat. And should you be scared of eating it? Now, I'm not trying to start a war between the carnivores and the vegans here, but I think it's time to look at the